So now I'm delighted to welcome back our ataxia expert, Dr. Susan Perlman. Dr. Perlman is the clinical professor of neurology and director of the Ataxia Center at UCLA Medical Center in Los Angeles, California. Welcome, Dr. Perlman.
Thank you, Lori. Thank you for having me back. And I want to let everybody know that even questions that we don't get to or that I may not have an answer for, Lori does help me follow up on those. So, if there's something that, you really want an answer to and we just didn't get to it, Lori can at some point forward that to me and we can deal with that. I know one of the things that came up the last time was the Undiagnosed Disease Network, which is working on collecting saliva, DNA samples that you can get from saliva to further genetic research or research into modifying factors that could influence a non-genetic ataxia or other neurologic disorder. So if you have not already registered for that, and given a saliva sample, signed their consent form, you can go to the website Undiagnosed Disease Network, and they have regional sites that can send you a saliva kit, can talk to you about the consent and the goals of that program. And I think it's important even for people with known diagnoses to give a DNA sample so that more can be found out about modifying factors or other genetic factors that might influence your ataxia. I did collect 4 questions that I didn't have the answers to the last time, and I went and researched them. Someone had a question about taurine and its use in neurologic disorders and in ataxia. It is a chemical that your own body makes. Infants don't make it at enough levels, and so infant formulas are often supplemented with taurine. And it helps with muscle function. It's an antioxidant. It improves energy production. So there are a lot of things that this chemical does that your body is making it already. Taurine supplements are out there. They've been looked at by the FDA. They're felt to be reasonably safe. There are no known side effects. But with any nutritional supplement, start one at a time. Try to take it within whatever guidelines you can find. And stay on it for a month or 2 and see how you feel. Similarly, a question came up about an agent called dihydroxyflavone, 7,8-DHF, which I had not heard of. Apparently, it's a flavonoid chemical which mimics brain-derived neurotrophic factor, which can activate neuroprotective pathways. It's been under research in Alzheimer's disease, Parkinson's disease, depression. I did not find any active trials in a quick search of clinicaltrials.gov. And apparently it is available on the internet. And, I didn't have enough time to look at the different suppliers of it. But again, any available supplement, use cautiously. And then there was another question about spinocerebellar ataxia type 34, which is associated with decreased production of very long-chain fatty acids, which are important for nerve health. And there should be good research going on with all the spinocerebellar ataxias to look for interventions. And I know that there's going to be some questions about clinical trials, and as they come up, we will address them. So I'm going to look at the questions people have posted already. Ramiro has asked, is it possible to have a certain type of ataxia and pass on another? For example, one having ataxia type 8 and passing on ataxia type 3. There are families where 2 ataxia genes are running in the family. But if the only mutation you have is in one of the spinocerebellar ataxia genes, you cannot pass a different one on. If you passed one on at all, it would be the one that you have. Lisa, if a sibling has ataxia, but we don't know what kind. Can her doctor tell us what it was after her death? So an undiagnosed ataxia, if the individual has banked DNA, or if there was research ongoing that a project that individual was involved in who then passed away, that information could clarify the type of ataxia that person had and what the risk is for others in the family. So it would be important for other family members to be in touch with the treating doctor to see, if there's information that may help the rest of the family. Julie has asked, citalopram is a drug listed near the bottom of the SCA3 research pipeline. Since it is commonly used as an antidepressant called Celexa, could it be prescribed off-label to a SCA3 patient as a trial to see if there is any improvement, rather than waiting for it to be developed into a possible therapy for SCA3? Yes. There are available drugs and nutritional supplements that we've already talked about, but there are certainly available drugs that are approved for one condition, but with enough evidence behind them could be safely tried, because we know the side effect profile, for other off-label uses. It's a good discussion to have with your physician. Mary, many of us are furious that the FDA did not even deign to review the Biohaven new drug submission for troriluzole. And this is a big mystery. I think for those of us who aren't intimately connected with the FDA. We are ready to take action, letters, phone calls. What action do you think would be most effective? I think working with the National Ataxia Foundation to make the patient voices heard. And also allowing Biohaven, to further discuss with the FDA why they did not want to review the file as it was submitted. I wish I had contacts at the FDA or in Congress, but I think all of us, could, certainly work through the National Ataxia Foundation or through our congressional representatives to make our voices heard. Pat is citing Dr. Norman Doge, who mentioned some success with portable neuromodulator stimulation with spinocerebellar ataxia in his book, The Brain's Way of Healing. Can you give us any additional information about this treatment? So this is something that I am going to look up, and I will get back to Lori about this. I've heard of him, but I am not immediately familiar with his technology and how it works. Here's an anonymous individual. I am quite able to walk unassisted, but when in a lineup or walking slow, I freeze up and movements are stiff and jerky. Is this normal with ataxia, and is there anything which can be done for it? Gait in the ataxic person can be manifest changes in different ways. So for instance, some people can walk quite freely, but their feet are further apart. Some people walk unassisted, but they veer. Some people have to walk slowly because they need to feel that control to avoid, going forward or going to one side or the other. Now, freezing up with movements that are stiff and jerky, especially when walking slow or in a line, is usually a sign of changes in the basal ganglia, the part of the brain that controls Parkinson's type symptoms. It could also happen if your ataxia is accompanied by spasticity, so that when you're not moving or have been standing still for a while, you can get stiff and you have to loosen up. So with the freezing aspects, I would discuss it with your physician to find out if you might have a little involvement of Parkinson's pathways or a little involvement of spasticity pathways, which can be treated to help with your physical therapy and exercise program. Sean, Is there a resource of genetic labs that perform whole genome sequencing for repeat expansion? Repeat expansions do not show up on whole exome or whole genome sequencing. For repeat expansions, it's a different way to analyze the DNA, and it has to be done with a different protocol. But there are many commercial labs that will perform a panel of repeat expansion tests, dominant and recessive, will perform a panel that includes whole exome sequencing or even whole genome sequencing. And the best way to find out about that is to discuss it with your neurologist or geneticist. Okay, Tiffany, can you please touch on stem cell research? There has been research around the world, in the United States, in Asia, and in Europe, on use of stem cells for neurologic disorders, whether it's stroke or spinal cord injury or progressive neurologic disorders like Parkinson's disease or genetic neurologic disorders, with the idea that in cases of injury, stem cells might be able to be implanted and grow in and replace the damaged nerve pathways. That was one theory about how that might work. In the degenerative disorders, genetic disorders, where there is a slow thinning and then loss of nerve pathways, it's felt that stem cell infusions or stem cells given into the spinal fluid could stimulate nerve growth factors, which would allow the ailing nerve connections to kind of grow back or strengthen themselves. And there is active research going on, being developed, primarily in Taiwan and in South Korea for genetic and non-genetic ataxias. And the Mayo Clinic also has a stem cell project for non-genetic ataxia, multiple system ataxia. Ray has a question. Is it worth traveling 500 miles to an Ataxia Center of Excellence, given that I've already had blood and genetic tests that did not find a cause of my ataxia? I'm glad the blood work was done to look for acquired causes of ataxia, poisons, toxins, vitamin deficiencies, immune system problems, etc. And then genetic testing. There are constantly new genes that are being discovered. So I think it's important to be involved with something like the Undiagnosed Disease Network, or to at least bank a DNA sample with an Ataxia Center of Excellence involved in new gene discovery. Now, managing an undiagnosed ataxia, and at least 30% of my adult ataxias are undiagnosed, in that there's no obvious acquired cause and no obvious genetic cause. So symptomatic management you could do with your local neurologist. You could arrange a video visit with an Ataxia Center of Excellence to discuss your symptoms and get their thoughts about management as well. I think about one of the few benefits that came out of COVID is a greater acceptance in telemedicine. And you can do quite a bit of the neuro exam by telemedicine, not everything, but you can do parts of it. So I think if there is an Ataxia Center of Excellence near you, 500 miles isn't that far, relatively speaking, see about setting a telemedicine visit up with them and discuss additional questions you may have. Mark has a question. How prevalent is ataxia brought on by stroke? So ataxia can be caused by a stroke affecting the cerebellum, which is not the most common part of the brain affected by stroke, but it is reported. More often, though, stroke occurs in the upper brain areas, which provide important information to the cerebellum. So you can have a stroke in the upper brain, which is a common place for strokes to occur, that causes symptoms that are similar to ataxia because the messages that are normally shared with the cerebellum have been interrupted by the stroke. Treatment, though, the foundation of treatment of all ataxia is physical therapy, rehabilitation interventions, which should be pursued. Anonymous attendee, I have spinocerebellar ataxia type 6. I am desperate. I hate feeling this way. Is there any medication? So with ataxia type 6, there, is obviously going to be a gait disorder. There can be speech involvement. There may be dizziness. There may be tremor. And there are symptomatic medications that are used off-label that you should discuss with your neurologist. You should also, participate in any available research. If you go to the National Ataxia Foundation website and look at their research pipeline, you can see that there are several drugs in the pipeline for ataxia type 6 that you could become involved in research for. But the foundation of all ataxia protocols is really physical therapy, home exercise program, things to work on your core, things to work on cardio, and things to work on balance. Lori has a question. Is it common for ataxia people to experience episodes where your knees or hips seem to buckle or give out, causing you to fall? Now, if you're standing still and your knees buckle or your hips buckle, it could be because of incoordination of the muscles that control and stabilize hips or knees. When you're standing, your quadriceps, for instance, is engaged, and your, the muscles on the back of the leg, the back of the lower and upper leg, there are several there, are relaxed. So that if that coordination of muscle strength between the hamstrings, the quads, the gastrocs is incoordinated, the knees won't be able to maintain a stable posture and could buckle. The same thing goes for the hips. And the best way to control that, which could appear during standing primarily, or during walking as well, where you have to alternate muscle use, is with rhythmic repetitive exercise under the supervision of a physical therapist. Now, Diane, I had genetic testing with Athena. My results showed that I'm an autosomal dominant with a variant of unknown significance for the PDYN gene and the SPTBN2 gene. I was told that I have spinocerebellar ataxia type 5 or type 23. I would like for sure to know which subtype I have. I know of no one in my family affected. My only sibling and both parents have passed away. Do you think it would be to my benefit to be retested? I would say yes. Retesting is important. The fact that you have variants of unknown significance could mean that these are small changes in the location of those two particular genes that you've identified that may not affect the activity of the gene at all. And from year to year, we learn more about these small variants of unknown significance to be able to say, yeah, that change is probably going to cause disease. And that change is less likely to disrupt the function of the gene. But certainly to be retested and to bank your DNA at one of the Ataxia centers for further research. Okay, Louise has a question about the Celos IV Trihalos trial. Has it had any positive results? The earlier studies of intravenous Trihalos in ataxia type 2 and 3 were felt to have shown some benefit for symptoms, potentially slowing progression by the action of Trihalos given intravenously on breaking up the abnormal protein clumps that occur in the nerves with spinocerebellar ataxia type 2 and 3. And I know they've extended their trials to some of the other ataxias that are common in Japan and Korea, where there is also a buildup of an abnormal protein. So the current trial is focusing on spinocerebellar ataxia type 3. There are no results yet. Enrollment has been temporarily paused, and is expected to resume in the fall. Will they be offering a second year with guaranteed drug, not placebo? Most drug companies who have their first year, either placebo or active drug, do offer an additional 6 to 12 months of real drug for everybody. So again, I think this is something they are thinking about, and will hopefully announce that when they reopen enrollment. Colleen, I have had symptoms for 25 years, diagnosed with spinocerebellar ataxia type 5 about 2 years ago. My grandson was recently diagnosed with epilepsy. Is there any relationship? There are pediatric forms of spinocerebellar ataxia type 5, which present with cerebellar findings and are typically non-progressive. So there are variations in phenotype. Epilepsy is more known to be associated with spinocerebellar ataxia type 10. Certainly, your grandson, should be screened for motor performance as well, to make sure that the ataxia type 5 gene was not passed on to him. Ernest, is ataxia use it or lose it? I pretty much stopped talking with people and stopped doing stuff outside the house during COVID, which many of us experienced. My speech and mobility were basically fine. Now I use a walker all the time and my speech is unintelligible. Is my COVID behavior to blame? Can I get my speech and mobility back? So I'm hoping that since, COVID has been receding, and it's, easier now to get out and do things, go to a gym, go to a physical therapist in person, that you've been able to pick up the physical activity and reintegrate it into your life. I think some, focused physical therapy, looking at gait, upright stability, standing and walking, will help you feel more stable and potentially be able to reduce your use of the walker. And the same with a speech therapy program. However, if your ataxia is a progressive ataxia, certainly over the 3 years that you were isolating because of COVID, the disease itself could have progressed in the background. So I think you can recover some of your speech and mobility, but you may not get back to your pre-COVID baseline. Now, Kathy has an interesting question that I'm probably going to have to look up. What are the potential benefits for spinocerebellar ataxia of the drug cerebro-lysine? Cerebro-lysine. Drug used for brain regrowth, cognitive health after stroke, traumatic brain injury. I am not familiar with cerebro-lysine, and I will have to look that up, and I apologize for that. Peter, if I walk with a rollator for 3 hours in a supermarket, I will be exhausted until I nearly don't make it back to my car. Is that good or bad? Same thing for working in strange positions. So it's possible to overdo. Ataxia is known to cause fatigue and to make you more liable to become fatigued. If you push yourself with any activity to the point of pain or fatigue that persists for more than a couple of hours, you've done too much. Now, for the practicality of being in a supermarket for several hours, you probably don't want to push yourself to the point where you can't make it back to your car. That's a very practical situation to avoid. So maybe, if you're close enough to the supermarket, split up your marketing into 2 1-hour sessions or 1.5-hour sessions to save your energy. Elaine has a question. Are there proven links between chemotherapy and accelerated symptoms of known ataxia, ataxia type 6, for instance? Chemotherapy is, many chemotherapies are known to cause damage to peripheral nerves, which means they can cause numbness, they can contribute to weakness, fatigability, which can complicate an ataxia. There are drugs in the chemotherapy armamentarium that can also damage the cerebellum. And there are other drugs out there that are known to damage the cerebellum. Amiodarone is a heart medicine that can have toxic effects on the cerebellum. Dilantin is an older anti-seizure drug that can be hard on the cerebellum. So I think if your starting a chemotherapy regimen or a strong medicine of another type, talk to your doctor about potential side effects and the impact it could have on your cerebellum. Okay, Fraser has a question. I have ataxia, but I don't know the disease condition or the extent that I have. So you need to meet with a neurologist who is either a specialist in ataxia or in movement disorders, who can help, extend your diagnosis, extend your evaluation, and help you narrow down the possibilities for the cause of your illness. Francis, my mother was tested in the 80s. Are those 100% correct? So the gene tests for the common genetic causes of ataxia weren't developed until the 90s and moving forward from there. If she was tested for, chemical imbalances, metabolic problems, certainly there are more sensitive tests now to define something that may have showed up suspiciously in the 80s that could be better defined now. So it would depend on what her testing showed. Did it show something that we have better testing for now? Did it show nothing that we have better testing for now? Brian, what do you know about autoimmune cerebellar ataxia? It has hit my central nervous system hard. If it is a documented autoimmune cerebellar ataxia, number one, you have to rule out a small hidden cancer that could be producing the bad antibodies. Number two, if you have a known autoimmune disease, lupus or something like that, obviously you would pursue treatment for the lupus and hope that it could take some of the stress off the cerebellar ataxia. If it's an autoimmune process that doesn't seem to be connected to a known rheumatologic disease or a known, a hidden cancer, you can, there are treatments that could be tried to stabilize, dilute out the bad antibody and help reverse the symptoms. These could be things like a course of high-dose steroids, intravenous immunoglobulin, IVIG. Rituxan is an immunosuppressant drug that can selectively suppress the cells that make the bad antibodies or antibodies in general. So there are definitely ways, and plasmapheresis to filter out the bad antibodies. So there are definite approaches to try to control autoimmune cerebellar ataxia that you should hopefully be pursuing. Jenny, my insurance will not pay for open-ended genetic testing. So far, the tests are coming up negative. Is there any point in my paying one of the commercial labs to do the whole genome sequencing? Dante claims that it has rare disease report that covers most of the SCAs. Is this a good use of my money? It depends how much they're going to charge you. There are labs that can do whole exome sequencing, whole genome sequencing for under $2,000. That is not a small amount of money, but it's better than an open-ended panel that could cost over $10,000. So I think it's a discussion you need to have with your neurologist and also with a genetic counselor to choose the best lab that will give you the most information relative to what's known about your ataxia. And Pat has given me a reference. I'm going to look that up when I can get my hands on his book. Tamikia, if you know you got ataxia via acquired ataxia, is it important to still get genetic testing? It is important to have your DNA participate in research. If you have an acquired ataxia, depending on the cause, why did you acquire it? And other people who may have had the same medical or other exposure did not acquire it. There could be genetic risk factors that made you sensitive to whatever caused your acquired ataxia. And this is being explored through research labs. However, even if you have some, indication that you were exposed to poisons or toxins, or you had a severe vitamin deficiency that caused your ataxia. It doesn't make you immune from other genetic factors. So I think it's reasonable to pursue, appropriate genetic testing, which again is best to discuss with your neurologist and also, with a genetic counselor. Now, Sion has a question. We are based in Uganda. My mother has spinocerebellar ataxia type 2. Are there trials for cure going on now? Answer to that is National Ataxia Foundation on their website has the pipeline for drug development for ataxia type 2. There are several companies that have ataxia type 2 as the primary genetic disorder that they are pursuing treatment development for. So you should certainly, kind of look and see, what the status of that research is. She also had involuntary movements. Is this because of the Matapor, a medication prescribed by her neurologist to help movement? It could be. Or because of the ataxia type 2, it could be. How can we differentiate? So, the Matapor medication that was prescribed, I imagine, slightly before she developed the involuntary movements, could be tapered down. A reduced dose could be used to see what happens to the movement. Ataxia type 2 is noted to have involuntary movements. So approaching that directly with different medications might also help. So is there any research or other things in spinocerebellar ataxia type 48? So we can go to the neuromuscular homepage on the internet and look up cerebellar disorders, look up spinocerebellar ataxia type 48 in the list, get references or go to PubMed, from the National Library of Medicine and look it up, and I will do that. I know that most of the spinocerebellar ataxias, and they're now up to SCA50, were found, the genetic cause was found by groups that are doing that research. So I think to find the people who first described the genetic factor and see what they are doing about therapeutic research. Janet, how soon do side effects start with Skyclarys, which is a drug that has been recently approved for Friedreich's ataxia? I have been on it since July 25th and noticed a rash on my chest yesterday. Never had skin problems before, also stomach cramps today. I'm 61 with Friedreich's ataxia, obviously. So if you look at the list of potential side effects, they list headache, they list GI upset, they list rash, they list fatigue. A minor rash, if it's not increasing and developing into hives, and a major, major allergic reaction, potentially you could treat with Benadryl or a topical agent. And most of these early, relatively mild side effects do go away after the first month or so. Other things that you're going to want to monitor, and presumably your prescribing doctor will do that, would be your liver function studies and a chemical called BNP, which are markers of liver function and heart function. So yes, this could be a side effect. They typically start early within the first month, and often after the first month, they will slowly go away. Kyle, my 8-year-old daughter has ataxia telangiectasia and was diagnosed in January. She is progressing fairly quickly. There doesn't seem to be any treatment that any doctors are offering. Are there studies with CBD in children with ataxia? There are studies with CBD. There are drugs in the pipeline for ataxia telangiectasia. I don't believe there are any active trials at this time, but certainly over the next 6 months, 1 or 2 of these pipeline drugs will be recruiting, for active trials. So I think if you stay in touch with the National Ataxia Foundation or the Ataxia telangiectasia, Children's Project, which is connected with Johns Hopkins, you will be able to keep track of potential disease-modifying trials. Now, if she is progressing fairly quickly, you want to make sure she's getting appropriate rehab. You want to make sure that there is nothing else going on, infections that could be undermining her performance. She is at risk for cancers, leukemia, lymphoma in that age group. And that should be screened if there has been any noticeable progression, as you point out. Anonymous attendee, is there a link between MS and SCA? Is MS a type of SCA? MS, multiple sclerosis, is an autoimmune disease of the nervous system. There are antibodies being made that are attacking the myelin, denuding these long nerve pathways of the insulation they need to function properly. It is not classically a genetic disease, although there are felt to be genetic risk factors, and it is not classified as a spinocerebellar ataxia. However, MS can cause ataxia symptoms just like SCA can, and the treatment approach can often be the same. Elaine, I have tremor in my legs when standing from a seated position. Is this due to strength or cerebellum? Is there any help for this? So again, as we talked about previously with hips or knees unexpectedly buckling, when you stand, you have to coordinate the muscles on the front of the leg and the back of the leg to smoothly work together, contracting and relaxing in a coordinated fashion to get you from the seated position to the upright position. If you have ataxia, that type of maneuver can cause tremor. I mean, think if you have ataxia and you're reaching for something, you could have tremor. Similarly, when you're changing position, the muscles involved could show tremor. On the other hand, if you're weak because you are not walking a lot and not doing exercise for your hips or legs, that could be an additional component. Working on core strength, on hip and leg strength in physical therapy or with an exercise program can help stabilize this. But if you do have tremor that comes from the cerebellum, there are medications that have been used to help control that. So Bernice, have advances been made for SCA2? You're right. A lot of the entries in the pipeline on the National Ataxia Foundation website seem to be for SCA3, which is the most common one. But there are several companies that are developing disease-modifying therapies for SCA2, and hopefully they will be in clinical trials within the next 12 months. Kathleen, is there anything to take to gain muscle mass back? I do work out 3 days a week already and would like to gain mass back because it does affect me physically. So the thing is, in spite of your exercise, which I presume includes some strengthening, targeting, the muscles in your legs or arms, wherever, it sounds like you're having thinning of muscle because of changes in the motor unit. In many of the ataxias, the cerebellum's involved, motor pathways can be involved, causing weakness and thinning of muscle or causing spasticity in muscle. Sensory pathways can be involved, causing numbness or altered sensitivity. So obviously strengthening exercises can help. There are certain supplements that are touted in the bodybuilders literature that may help. Taurine is one that I mentioned earlier. Creatine is one. So I think you could, take a careful look at, the literature, the popular literature, get a sense of, who's using what supplements to help muscle mass. But do recognize that exercise is always going to be the foundation of it, and adequate protein intake. Make sure that your diet has enough protein. Fraser has an interesting question. I'm 62 and brain fog is something that I am concerned about. Now, is your brain fog connected with an ataxia syndrome? Many patients with neuromuscular disorders affecting central pathways like the cerebellum complain of something they describe as brain fog. And we know that with the cerebellum, besides coordinating in coordinating movement and balance, it does coordinate speed of memory and thinking. So you might feel that your brain has slowed. It takes longer to put things together intellectually. And this is, definitely connected to the cerebellum. On the other hand, brain fog could be a side effect of a medication or a supplement. So take a look at what you're consuming. It could be a side effect of disrupted sleep. So again, take a look at your sleep pattern. So, brain fog should be further investigated, even if in the end it turns out to, be a known symptom that could affect people with ataxia. Kathleen has a really important question. Is any clinical trial for SCA3 coming up? Currently, all of the previously active trials for SCA3 have either been paused or abandoned. And I know that there are other companies in the pipeline who will hopefully be starting trials. Hopefully some of the paused trials will open up. I think in the next 6 months or so, there will be some trial opportunities for people with SCA3. Sue has a long question here. I tripped over a throw rug and did a face plant on the floor. I did not go to the hospital as I didn't break anything. A week later, I passed out taking a shower and briefly lost consciousness. I woke up lying on my back. I believe I hit the back of my head. About 2 weeks afterwards, so we have two things here. We have a face plant, which could have jostled the brain. We could have, we get passed out in the shower, probably hit your head on the way down. And now 2 weeks afterwards, noticing a change in speech, started falling. Have had multiple MRIs and tests, was told that I did not have a stroke, and obviously not a bleed either. I have not been officially diagnosed with ataxia, but I have so many symptoms. So one thing I would wonder about, if you didn't have a stroke or a brain injury or bleeding from those two injuries, could you have a concussion, which can cause symptoms that mimic those of ataxia? I've seen 5 neurologists over the past 7 years, and not one doctor mentioned ataxia. So question is, have your symptoms since those injuries progressed, which would suggest some progressive problem going on? Although tested negative to most neurologic disorders, should you consider genetic testing? That question, should be brought up with your neurologist or a genetic counselor. Concussion symptoms will usually stabilize or resolve after a year or so. But if you've had progressive symptoms, that could be a sign of an underlying genetic factor, or an undiagnosed acquired factor. But it sounds like some of your neurologists have already tested for the acquired causes. So, Kyle has a follow-up question. We met with the geneticist on Monday. She had COVID prior to diagnosis and has never regained her sense of smell. She's also had unexplained fevers on and off for the past 2 years and bruising on her spine that the doctors say was lack of a fat pad. Blood testing was done last week, waiting on results. I'm glad you're following up with that. Another anonymous attendee, I've been experiencing terrible hip and leg pain, and upon mentioning this to the doctor, in the context that you have ataxia type 6, I feel that they say, oh, the pain is being caused by your ataxia type 6, and they hesitate to continue investigating. Do you suggest we not mention our situation if it's not visible until after them finding the problem? I really want my walking to be at its utmost best physically before my walking inevitably deteriorates. So if you're gene positive for ataxia type 6, and if you have some mild balance problems potentially that are not, terribly obvious to your examining doctor, and you're having hip and leg pain, which are not typical symptoms of ataxia type 6, they need to be investigated as separate conditions. You could have a spine issue, you could have hip issues. I think, certainly, it's not ever a good idea to hide, any pertinent medical conditions that you might be experiencing. But your doctor should know that hip and leg pain are not symptoms of ataxia. They could be secondary problems because of altered gait, but certainly deserve a more orthopedic evaluation. Maggie, what common medicines, for instance, cold and allergy medicines, should be avoided for ataxia people? So there are decongestants, which could clear up a cold and allergy symptoms, but are known to have some side effects. There are antihistamines that you can use for allergy symptoms that can make you drowsy and cause dizziness or imbalance. So I think, if you look up online common side effects of commonly used medications, it's not that these medicines should be avoided, but they should be used carefully. It's like they caution you, if you're taking a drug that's going to make you drowsy, don't drive. Certainly if you have ataxia and you're taking a medication that you need to take, then it makes you a little more dizzy or a little more fatigued. Be careful, be more careful moving around. But there are none that should be avoided because they're going to have a detrimental effect on the ataxia itself. It's just going to make your symptoms more noticeable. Brian, my twitching is out of control. I'm under the care of a doctor at the Mayo Clinic to help with the twitching. He prescribed propranolol. It made no difference, along with the ataxia, severe dysarthria, diagnosed with, some, immune-mediated disorders, talked about that could be behind your ataxia, went through everything, tried IVIG, Rituxan, did nothing, currently on 2 other agents. Symptomatically for twitching, there are other drugs besides propranolol which could be used. And I think, certainly, discussing symptomatic management, even as they try to work out strategies for the autoimmune factors. Then, John, MRI from the VA showed spots on the gray matter. Is this normal? The MRI that shows spots may be showing hardening of the arteries, which can happen to all of us as we get older. It will show up on an MRI scan as little white dots scattered around, the upper brain typically. If there are broader areas of change in color or intensity affecting the gray matter, then you would worry about some process, larger than just a small hardening of the arteries that could be impacting, the white matter that connects to the gray matter, causing changes as we had, talked about earlier, demyelinating changes, which in the hereditary spastic ataxias and hereditary spastic paraplegias, those white matter pathways can be affected, and they might show changes on the MRI. Then, let's see who else has a question. What percentage of cerebellar ataxia have GAD65 antibodies? And what percentage of the general population has these antibodies? Low levels of GAD antibodies are seen. And, if you have had a GAD antibody test and they were mildly elevated, it's important to be retested to see if it might drift back into the normal range. Notable elevations, and there's a range, into, the tens, into the hundreds, or more than 250, which I think is the upper limit of, various assays to be able to measure those, are more typically associated with neurologic issues, stiff person syndrome, and cerebellar ataxia. I don't know what percentage of the general population has had, GAD65 antibodies without a neurologic condition. They are seen with certain cancers. They are a risk antibody for diabetes, so that, in people with diabetes, if they were screened for GAD antibodies, they might show up. So I think in the general population with some of these other conditions, there may well be, lower levels of GAD65 antibodies. And the percentage of the cerebellar ataxia population with GAD65 antibodies, in my experience, with all of my patients with, presenting with ataxia, a percentage of them are going to have identified genetic factors. I think the GAD65 syndromes with my current patient population is about 10%. And again, remember, I see people with ataxia, so I'm going to be more likely to see individuals, with that as opposed to the general population. Now, a Zoom user, is there anything to stop or slow ataxia type 1? If we went to Japan, who would we go see? And do you feel the medication from Japan slows the disease? There is a medication approved in Japan for spinocerebellar ataxia, Ceridist. It's a thyrotropin releasing factor analog or stimulant. It's felt to have some ability to improve function of the cerebellum, but it's not clear that it would slow progression. It used to be you could only get it if you went to Japan in person and met with a doctor there who would give you enough of the drug to last until your next visit. But I understand that people have been able to get it over the internet. So I don't know about the availability of that one approved drug in Japan. Now, there is active research going on for disease-modifying therapies in SCA1. And again, on the National Ataxia Foundation website, you can look at the pipeline and see the companies that are not yet in human trials, but will be advancing to human trials. Now, Mark has a question: is cerebral stroke treatable with medication? So if we're talking about a stroke, the most prominent treatments are treat the underlying cause of the stroke. Was it a blood clot? Was it a narrowing of the arteries? And there are medications that can open up circulation, deal with the risk of blood clotting, that are best discussed with your neurologist or a stroke specialist. Now, the symptoms of a stroke, if the stroke is causing weakness, if it's causing ataxia, obviously physical therapy rehab is the best approach for that. But let's say the stroke has caused spasticity, that can be treated with medication. So depending on the type of symptoms the stroke has caused, there are medication and non-medication strategies. Mary, I'm 55 and just diagnosed with Friedreich's ataxia. Is there any research on the effectiveness of Skyclarys on older onset Friedreich's? Now that the drug is available, post-marketing data collection, which Reata, now Biogen, is hopefully planning to do, and as part of the Friedreich's ataxia clinical outcome measures natural history study, we will be keeping track of the effectiveness of Skyclarys across the range of people with Friedreich's. And currently, there, the FDA put no limitations on, age of onset of symptoms or age of the person with Friedreich's. And I think everybody with Friedreich's who can safely try Skyclarys should try it, so we can collect that information across the entire spectrum of people with FA. Now, Beverly, I have SCA2. I use electrical stimulation that strengthens my back and legs and have helped my balance and walking. Any comments for or against using this? So electrical stimulation to strengthen muscles has been a physical therapy modality for years. If your nerves are not giving enough stimulation to maintain muscle bulk and strength, you can directly stimulate the muscle, which will then help it bulk up, as it were, and may, as in your case, help with strength as well. With better strength, core strength, back strength, leg strength, balance will be better, walking will be better. And I haven't heard of any negative effects of using it. And I know, like I say, it's been safely used by physical therapists for many, many years. Danny, I have not found any specific information on SCA 43. Have I read any information about this SCA diagnosis? And again, I would send you to the neuromuscular home page, and it'll come up with a menu of neuromuscular and cerebellar options. Click on cerebellar, scroll down to SCA 43, and it should have information about it. And I think when we're done here, I'm going to look it up myself to see how much they have posted in there. Then anonymous attendee, I have a genetic autosomal dominant ataxia. My 2 adult children do not want to get tested. They each have 2 children. Should they be encouraged to get tested? Until there is a disease-modifying therapy that will make a difference in their personal risk status, whether it will be of benefit for them to know their gene status so they can start a treatment early. Many people say, until there's a treatment available, I don't think being tested will help. On the other hand, if somebody is planning a family, they may want to know what their gene status is. And here they each have 2 children, so that your 2 adult children each have a 50% risk of having inherited the autosomal dominant gene from you, and their children, if we follow down the mathematics, each have a 25% risk of having inherited the gene from you. And obviously it depends on their parents having inherited that gene. So I think it's a personal choice. Be interesting to find out why they don't want to get tested, and have that discussion. The children may decide to be tested. They can't be tested until they're 18. And if the parents, if your children decline to be tested, but your grandchildren decide to be tested and test positive, that automatically lets your children know their gene status. So I think there needs to be a fair amount of counseling and discussion that goes into testing and what benefits it might provide them. And then I see Danny, had actually, this was the initial question, and I jumped to his, secondary one. Recently received DNA results. The lab that NAF set up for me to use showed that you most likely have SCA 43. Well, I'm going to look it up and find out, what those symptoms are. And I think you should also. And one more question, anonymous attendee, can you speak about sleep disorders and ataxia, specifically sleep apnea? There are ataxias that have sleep disorders beyond just sleep apnea. They're called REM sleep disorders, and they occur during dream sleep where you act out your dreams, you talk in your sleep. There can also be involuntary movements while you're sleeping, leg spasming, periodic leg movements of sleep, as well as sleep apnea, which results either centrally, the sleep center is not timing properly because of changes in the brainstem associated with your ataxia, or the throat muscles, which are incoordinated because of your ataxia. When you sleep, the throat muscles over-relax and collapse and then obstruct your breathing. So number one, if your sleep partner or anybody who happens to be sleeping within earshot notices snoring, raucous breathing, flailing, other sleep behaviors that you may not be aware of, important to connect with your neurologist or a sleep doctor to have sleep testing done. If you have unusual fatigue during the day and you think your sleep is okay, one cause of excessive daytime sleepiness and fatigue could be disordered sleep. So I would encourage you to have that explored. And I think we have run out of time. A number of good questions in the middle here, and I'm sorry that we can't get to them. But you know, it shows that you're all paying attention to what's going on in the ataxia world, which is important. So thank you for giving me this opportunity, and I'll do my follow-up homework and report back to Lori.
Thank you so much, Dr. Perlman. As you said, so many good questions again this session, and you provided so just great information as usual. So thank you, everyone, for your questions. Thank you, Dr. Perlman, for being our expert again for this session. As Dr. Perlman said, that is all we have time for today. If you did miss anything, wanted to reference any of the information that was shared today, or any of the questions that were asked, a recording of today's session will be made available. And take care, everyone, and we hope to see you at the next session.
Good. Bye-bye.